Singapore is working to ensure its healthcare system remains affordable and sustainable in the long run. This amid growing healthcare inflation as the nation's population ages. The Health Ministry is introducing various subsidy measures to keep costs low for Singaporeans. Health Minister Ong Ye Kung also revealing that the ministry's spending has more than doubled over the past decade to $21 billion this year. The government is doubling down on preventive health in a bid to ensure that costs don't skyrocket and everyone can receive healthcare support when needed.
This government understands that healthcare is a basic and essential public service that Singaporeans value. We have the experience, wherewithal, determination, ideas and policies to upkeep and strengthen this key tenet of our social compact. Our agenda for healthcare is transformative and long-term and will take us well beyond this budget year.
Among the measures, the annual MediSave withdrawal limit for outpatient treatments will be increased, with withdrawal limits for MRI and CT scans doubling to $600 from next year. More than 500,000 patients are expected to benefit from this change. Sabrina Ng reports.
This is a growing sight in Singapore, one that reflects an aging population and rising care needs. To help Singaporeans cover healthcare costs in their later years, MediSave withdrawal limits are carefully set. But there's also the challenge of making care affordable for those who need it now.
We cannot let the healthcare expenditure curve escalate uncontrollably. It is a bill that all of us ultimately have to pay, as taxpayers, as patients, or as insurance policy holders. But it is very difficult to rein in escalating healthcare expenditure, especially when it is a matter of life and death for ourselves or for our loved ones.
To keep the healthcare system sustainable yet affordable, the ministry has introduced several subsidy support measures. Annual withdrawal limits for Flexi MediSave will increase from $300 to $400 come October. The scheme allows those 60 years old and above to tap their own or their spouse's MediSave to pay for outpatient medical treatments. The Health Ministry says this move could potentially benefit up to 700,000 patients. The government is also stepping up support for those facing irreversible infertility due to treatments like chemotherapy. From June, subsidies for procedures like egg freezing will cover up to 80% of the cost. And from mid-next year, patients can also use their MediSave or MediShield Life to help pay for certain fertility-preserving treatments. For those with chronic conditions, 3 drugs will be eligible for more subsidies at GP clinics later this year. For example, the cost of one high cholesterol drug will go down from $230 to around $30 to $60 a month. Ultimately, Minister Ong stresses that Singapore will continue to take a practical approach in its healthcare system and balance between providing quality and affordable healthcare.